Okay, so I filmed this video a couple of years ago when I had a wrist ganglion. The old school way of treating wrist ganglions was to hit it with a Bible or the phone book. There's plenty of videos on surgery. They're all very invasive. They run the risk of infection. So I basically come up with a new way of reducing the wrist ganglion, which essentially involves using a floss band to compress and push the fluid back into the wrist bones. Have a go. It's got to be better than living with the ganglion or having more invasive procedures done to it. You know, hopefully this will help one or two of you out there as well. I just want to show you how to reduce you can see I've got a wrist ganglion with a 2.5 centimetre floss band from Fashic, and I'm going to just hang on to it with your thumb, start wrapping, plenty of pressure over the ganglion, keep tying it on. Now I'm not going to use the whole band because there's no need. Once I've got pretty good pressure, I'm just going to hang on to the rest and just flex it through a little bit, and that's applying pressure onto the ganglion, pushing the fluid out back into the carpal joints, and we're just going to use a little bit of flexion extension. I'm just going to hold into slight flexion and just leave it there for a few seconds. Just let it do its thing. Now, when I take it off, it's not going to be gone. It'll take a few repeats. This is probably the third time that I've done this in the last week, the last 3 days actually. If your wrist starts to hurt or you lose blood supply to your fingers, you can see there's not much going on there, then time to take it off, and best just to keep repeating the exercise rather than do it one too many times. And there's the ganglion still there. It feels a bit softer, and it's certainly not as tender as it was the first time. A wrist ganglion, it's essentially just a little weakness in the pouch of the joint capsule. So we're just going to hold the end of the floss band, which you can buy online. They're quite cheap, and we're basically going to compress and compress and compress the carpal bones. And this will do a couple of things. One, it will, and I'm just going to hang on to the end. One, it will help to, like I said, apply pressure to the wrist, but it also helps to gently distract the carpal bones or the bones of the wrist. Once it's there, I gently just move through a passive and active. Once I've got the compression on there, just a gentle active range of motion. I'm not going to force it at all, and you'll find that over time your hand might start to go a bit blue. If it starts to hurt or you're getting pins and needles, just take it off. You do not want to do this if you have carpal tunnel syndrome, and this will increase the pressure around the wrist, but it's only very temporary, so most of you will be quite okay. So we're going to move the wrist back and forth like that. I'm going to do that for probably up to about a minute, and then I'm just going to basically just wait. After 60 to 90 seconds, I take the band off and I'll leave it at that. Now, if it's still quite prominent, I might just repeat the exercise a couple of times, and with the protocol I would do this morning and afternoon for 2 to 3 days, and generally after 3 to 4 days you're going to find that one morning you'll wake up and it'll pretty much be gone. So if the lump is hard, if it's growing, if it's not going away, then absolutely you need to see a doctor, and just to make sure that you haven't got something else going on. All right, I hope this has helped you out. Like I said, I've done it on myself a couple of times and it's worked beautifully. I've helped lots of patients with this over the last few years, and it can be a very easy way to reduce a wrist ganglion instead of sticking needles in there, having surgery, ending up with scars, and you find that the flossing band is a really easy way to do this. So try the FRETS protocol, and you never know, it might help you out.